Alaikum. Thank you very much for inviting me here. It's really a pleasure to be in Tashkent. And I am going to talk about hepatitis C elimination in Catalonia, in Spain. These are my disclosures. Let's move to Europe, to the south of Europe, to Spain, and particularly to Catalonia. That is my region. And let's start with the current situation. Catalonia has 8 million of inhabitants. It's the region on Spain with the highest GDP, with the highest proportion of migrants, and also with the highest rate of hepatologists. Catalonia has a specific healthcare system, and the data that we have in the general population, it's a prevalence of hepatitis C in adults around 1%, and viremia, it's 0.49%, much lower than the prevalence that we have seen in Georgia or in Uzbekistan. What is specific in Catalonia, it's a strong political willing for hepatitis C elimination, and we have a specific guidelines for elimination with the goal of screening, particularly based on risk factors, search for diagnosed patients, untreated patients, and identification of vulnerable populations. And to reach these goals, the indications are test and treat, linkage to care, and simplification of procedures. What is good of this plan is the integration between other viral hepatitis B and C, HIV, and sexual transmitted infections. The situation in the risk groups in Catalonia shows that the prevalence of hepatitis C is particularly higher in people who inject drugs and in migrants. And these are the key populations that I would like to focus today. And I would like to show the challenges and the public health strategies that has been put in place, particularly for these populations. One of the things that I think is good in our plan is looking at undiagnosed infected people, and particularly hidden cases with diagnosis that are patients diagnosed but not linked to care in the general population. And for this, our guidelines promote screening for risk factors, and we have the reflex tested very well implemented. That means that in our labs, all serum samples with HCV antibodies, the lab automatically perform a reflex test for viremia. In addition, in primary care centers, not in every primary care center, but in some primary care centers, we have access to a gastroenterologist and expert in viral hepatitis. And also we are training the general practitioners and nurses on hepatitis C. So we are doing increased awareness and education. So let's start with the retrieval of hidden cases. And we are doing this looking at the database of the laboratory at the register of all hepatitis C positive cases, and we cross this information with the register of patients treated with hepatitis C. So we started in my center with this active search to retrieve diagnosed but untreated patients with hepatitis C. We search at the lab, and then we call the positive cases, untreated patients by phone, and we link it to care. We organize a visit to the specialist, and we repeat viremia, and we treat if viremia is positive. With this strategy, we were able to retrieve patients treated and cured. But what is more important is we show that this strategy is cost effective. So after this pilot, we started doing all of this in all Catalonia, and now this is an ongoing program. We are looking at the register of the lab and match with the register of treatments, and we know that we have a proportion of patients diagnosed but untreated. This is around 34,000. And we are now looking and calling all of these people. These are the preliminary results, and these preliminary results are very similar to those observed in our pilot study. The second strategy is looking at people who inject drugs. We have a very high incidence. This is the reservoir of hepatitis C in my country, and we have a specific guidelines for this population with the goal of test and treat, particularly in the addiction treatment centers, because this is for these people a friendly place to receive the diagnosis and treatment. In addition to screening, we have put also prevention strategies, harm reduction programs, opiate agonist therapies, and of course, treatment of hepatitis C. This is the cascade of hepatitis C screening and treatment in these drug addiction centers, and you can see that we have approximately the number of people I have shown before. It's about 30,000 people who inject drugs. We have offered screening in the majority of them. They have accepted a high proportion. We have identified 23% anti-HCV positive cases, viremic patients 8%, and we have treated the majority of them, and also we look to reinfections. That is an issue in this population. A third point is migrant people born in countries with medium and high prevalence, and for the reason we have community programs in different populations. This is our program in Mongolian people living in Catalonia, and the nice of this program is that we have an audio-visual activity before screening for education. Then we perform a knowledge questionnaire, a rapid test for hepatitis B and C, and the positive cases we did plasma separation cards for viremia, and then we link to care. And with this program, we have identified and treated hepatitis C patients. There is another program, also a community program for hepatitis B and C, that it's doing in cultural centers, and we screen patients, people from sub-Saharan Africa, from Ghana and Senegal, living in Barcelona for both virus B and C. And we observe that the majority of these anti-HCV positive or HBs antigen positive patients were linked to care. And these are several community-based interventions running in Catalonia during these years. In addition, we have an emergency department screening in several hospitals in Barcelona. That means that people admitted at the emergency department and requiring a blood test are screening for viral hepatitis. And this program is very well offered and with educational programs and emergency department. And we found at the emergency department a prevalence of hepatitis B and C much higher than in the general population. And the good of this program is the high rate of linkage to care. And finally, there is also a specific program from the 7 prisons in Catalonia. And I think Professor Esteban will talk more on this, but this program that has as a good thing a liaison nurse has shown an important decrease in viral hepatitis C in prisons, and these inmates are treated in the prisons, in the center. So in total, we have treated a large number of patients for our population, and this has impact clearly in the number of patients that are in need to treatment has decreased. And for me, even more important, the number of patients with late presentation that arrive with advanced fibrosis has declined from 44% at the beginning of this program to 25%. In addition, we have observed an important reduction in hospital admissions related to hepatitis C infection from more than 50% at the beginning of the program, and now it's expected even to be lower. And it's very rare now to see a patient with hepatitis C admitted in my center. Finally, the proportion of liver transplant patients, it's more or less stable in Catalonia, but it's an important reduction in the number of patients transplanted related to hepatitis C. And these patients now are transplanted by hepatocellular carcinoma, not for advanced or decompensated liver disease. And finally, we have seen in Catalonia an important decline in mortality related to hepatitis C. And now it's around 10 per 100,000 population. So in summary, we are treated fewer and fewer people because there are fewer and fewer people left to treat. We must make an intensive and equity effort to find the most vulnerable people and those with the highest barriers to access to the health care system. I took this because I think this is a very, very nice summary for the last year for the World Hepatitis Day. Thank you very much for the invitation.